Surgeons and doctors have read it. What's the dumbest thing patients have lied about? My little brother was a nurse for about a decade. He has said many times that people stick anything up their butts. From light bulbs to hairbrushes to a golf shoe. And at first, it's hilarious. Then after a year or so it's not funny because you've seen way too many distended buttholes. Then after a decade or so it starts to get funny again because you think you've seen everything, and then one day a 45-year-old man is driven to the hospital by his wife and he has a golf shoe up his ass and he told his wife that he and the boys were golfing and he slipped in the locker room and it got rammed up there, completely disregarding the fact that the part of the shoe that is inside him is covered in Vaseline. Honestly, the dumbest lies are the one people who lie about how much alcohol or other drugs they use. Alcohol and benzodiazepine withdrawal can kill you. And if you use opiates from the street, then you likely have a higher tolerance, and may need more medications in the hospital, so be honest. I truly don't care how much you drink or use, I just don't want you to get worse for something we can plan for and prevent. A common one is about their smoking. Smoking is an enormous risk factor for fracture non-union, meaning a fracture that doesn't heal. When I walk into a non-union patient's exam room and it smells like a cigar den, I know they smoke. But they will tell me they don't right to my face. Before signing them up for revision surgery, I commonly order a urine test for nicotine metabolites. Often, it will turn out positive and suddenly, surprised Pikachu face. Part of my job is dealing with medical records. My favorite part is when you are reading the doctor's notes, and you can tell they are fed up with the patient's bullshit from their tone. Patient in for routine colonoscopy, asked if solids consumed in 24 hours prior, patient confirms that no. In process of procedure, several dozen kernels of corn are discovered in colon and cannot continue. Patient specifically instructed not to consume corn beforehand as this happened prior visit. Not considering the psychiatric and the boring answers, like people who just swear with all their heart that they are taking their medications when they clearly aren't, which is the vast majority, there's not much, really. Only one really unique comes to mind. It was a patient that was a really kind old man who always would talk a lot with us, telling stories, praising the beauty of everyone in a tender and respectable way, saying how really grateful for our work he was and so on. Said old man would always appear with really high blood pressure values, even though he would swear that he always used his medication correctly. After we did so many changes with his medication in many different ways, it's only natural to think that there's some problem with how he is taking them, if he was doing it at all. However, one day, after noticing that he would always go to the bathroom before even reaching out to the receptionist, someone discovered he would always eat a load of pure salt before being seen by any of the doctors, trying to make his pressure intentionally go sky high. Later we also, obviously, discovered that he indeed would not take his medications correctly as well, in order to obtain this result again and again. Turns out he suffered a lot from loneliness, and he was an old man that didn't have much contact with his family anymore. But mostly because his family didn't reach out to him almost at any given time, even though everyone lived close by. In his desperation, sustaining dangerous high blood pressure was the best way that he had to obtain human contact within the emergency every week. This was the oddest one, but it's really common for elderly patients to appear lying about their symptoms, only trying to gather some attention and a private minute to speak about anything else. Most of the time they book an appointment only to talk about recent trivialities, which makes them clearly better. Although by the end of the talk, it's also easy to see how they gather back part of the sadness that the loneliness brings to them. Around my patients, at least, it's common for many to cry as they leave. Loneliness is a hell of both a simple and complex problem, and one that no one should be bound to live with. Had a woman say she was 30 when she clearly didn't look it. Well, I moved on to other questions. I looked at her files and lab reports had her real age on them. 41, why? What difference does it make lying to healthcare staff? This is health-related, not your Tinder profile. Nobody was going to see this and go, I am not dating an old lady. By the way, she was married with children. I had a lady tell me she had no idea how she got a rash she had on her face. I left the room, gave my report, and when I walked back in with the doctor, she looked at me and said, "I didn't think you would be coming back in the room," and then proceeded to confess that she had been cheating on her husband and thought she had herpes. She did not have herpes. It's not so much a patient lie as it is me being dumb, inexperienced, and uncomfortable asking necessary questions. I had a hypothetical patient during residency that was a very manly veteran, and I was admitting him for rectal bleeding. He was in the age where it was more than likely to be colon cancer, so I didn't think it was necessary to ask a sexual history. Folks at this particular establishment were known to at times be homophobic, and I had been yelled at by patients previously for asking, "Do you have sex with men, women, or both?" It ate away at my conscience though, so I went back in absurdly nervously and asked him. He answered, "Son, I'm as gay as a rainbow. I've been at the bathhouse for the last couple of nights, but I wasn't sure how it would go over to admit it." That's when the bleeding started. It was a very important lesson for me. One of my favorite things I wrote my first year out of medical school. Please note, patient has stated multiple times that he wants to leave and would leave against medical advice. He asked multiple times whether he could eat and stating he is hungry. Explained to patient that we would like to start a full liquid diet first, and if he tolerated it well, would transition to regular foods. However, patient ordered Chinese food delivery instead. Then, patient was complaining of a headache. He was given Tylenol for the headache. Patient stated that this did not help him. His sister at bedside went to the nearby pharmacy and bought aspirin. Sister did ask whether she could give him aspirin. She was told not to give patient the aspirin. She supposedly did not. For context, the patient had a catastrophic gastrointestinal bleeding from taking too much aspirin. Had a patient, who wasn't to eat anything, swear to me she didn't eat any of the McDonald's her boyfriend brought in. She proceeded to vomit French fries and milkshake up 20 minutes later. She stuck to her story and still swore she didn't eat anything even as I was mopping her barf up off the floor. I'm an oral surgery assistant. We had a mom lie one time about her kid not eating, and afterwards vomited red slushy all over our newly installed carpet. I also overheard a mom ask her kid in recovery if they were hungry, and then say, "Well, at least you ate some of my sausage egg McGriddle before you came in." Needless to say, I told the surgeon, and the mom got quite a lecture about the dangers of not being honest and risking their child's safety. I was rooming patients, and I went to the full lobby and called the next one in by last name. They stand up and mom and dad and bring the little girl. I'm rooming them, take the vitals, review purpose of visit, make some adjustments to the chart, update their pharmacy and allergies and go out and let the pediatrician know they are ready. The pediatrician goes into the room and come out like 3 minutes later and says, "That's not my patient, where is my patient?" I'm like, what the hell? I go in and ask the parents, and in fact they were not the patient. I'm like, why did you say you were someone you were not? They simply said they didn't want to wait, so they just came back. We had to completely unspin all the changes to the chart and had to get legal involved to make sure there were no violations, and fortunately, there weren't. I'm fascinated that people can collectively think, "Yeah, let's do this, no one will know." Like, how does that even play out in their minds? Resident doctor here, this happened during my psychiatry rotation in medical school. I wouldn't say it was a dumb lie since the patient was mentally ill, but I would say it was the most memorable lie. There was a patient at a psychiatric facility. She constantly insisted that she had a mass on her breasts, and demanded to be physically examined only by male doctors. When the psychiatrist I was rotating under declined to perform a physical exam, she asked me to do it during my daily patient interview. I also declined physical exam but had a bit of a hunch to check her medical records. It turned out she had an ultrasound done a week before that found only normal breast tissue without masses. However, apparently this lady had frequented many doctor offices with various complaints of an unspecific nature and would usually focus on breasts or vaginal complaints when she visited male physicians' offices. We diagnosed her with factitious disorder and histrionic personality disorder. It seems her goal was mostly attention from medical professionals, but we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her are why doctors document everything meticulously. So, the patient wouldn't admit to making things up all the time. According to the psychiatrist I was working with, she didn't actually believe any of her health problems existed, and her primary goal was the attention from medical professionals. If she actually believed she was sick, we would have diagnosed her with illness anxiety disorder, commonly known as hypochondria. One dude lied about being paralyzed after a lumbar puncture. Got a call from a nurse's patient saying he couldn't move legs following a lumbar puncture. I called the team that did the procedure, and they assured me there was no indication of this sort of injury happening during the procedure, but agreed with my plan to get an urgent MRI. I went to examine him, and the nurse said she thinks he moved one of his feet. Next thing I know, he says he can actually move his legs again, but they are feeling weird. Then this weird feeling turns into intense pain, and he asks for intravenous narcotics. I tell him no because this story makes no sense. By God, it was a miracle, I tell you. when this man walked himself right out of the hospital after I refused the intravenous narcotics. Also, the MRI was normal. I'm just a medical student, but a doctor shared this with us. She's a gynecologist, and this woman came to her complaining about how she hasn't gotten her periods in few months. Well, she was showing menopausal symptoms, and in fact she looked almost 50, but she kept saying she's only 30, and she can have a menopause. It has a funny ending, when the doctor asked if the woman had a kid and she said yes, and that he's 27 years old. I don't know why people lie about their age, but this was a funny story for the whole class.